Hello, everyone. Thank you for attending today's webinar, Handle the Surge in Contact Center Volume in Your Healthcare Organization Post-COVID Vaccine Approval with Salesforce, presented by Neuroflash and Salesforce. I'm Andrea Anderson, and I'll be moderating this webinar. Our speakers today are Scott Jaworski, Senior Director, Service and CX Specialist, Salesforce, Steve Krummenacher, Head of Outcomes, Neuroflash, Eric Zhang, Director of Solutions Engineering, Neuroflash. Just a few technical notes before we begin. The webcast is being streamed through your computer, so there is no dial-in number. For the best audio quality, just make sure your volume is up. This webinar is being recorded and will be available on demand within 24 hours after the event. Time permitting, we will follow the presentations with a Q&A session. Please submit your questions using the Questions and Answers tab on the left side of your screen. All right, let's begin. Scott, please go ahead.
Thank you. All right, let's get to our agenda. Thank you, everybody, for joining us this afternoon. Our agenda today is we're going to talk about Salesforce and some of the products you'll be seeing today, ServiceCloud Voice and some bot demos. It's going to be great. Kind of the current environment where we stand. We're going to talk about it. We're going to get to see a demo. How to get started with Neuroflash and Salesforce, and then obviously open up for Q&A and questions and comments. But before we begin, we would love to do a poll and see out there kind of what you guys are up to. What part of healthcare are you in? Healthcare provider, payer, pharma, medical device, or something else? So if you can let us know what you guys are up to and what the sector you're working in, would be wonderful. So give everybody a second to answer that question for us. Thank you very much. All right, those results are coming in. All right, I see, let's take a look at some of our results. So we have a good mix today, some provider, a little bit of pharma, and something else. I love the something else, very intriguing what's out there. One more poll before we get into our content. Are you a current Salesforce customer? Yes, no, and of course, I don't know. You could be using Salesforce at your company somewhere in your organization and may not even know it just yet. So would love to know where you guys stand in terms of your Salesforce customer experience so that when you do ask questions, we know how to answer them properly. So we appreciate any feedback there. Just wait for those results to come in. All right. So here's some of our results. So it looks like a fair amount of you are Salesforce customers. That's great. Some of you are not. Even better. We love new customers. Welcome to the family. Good news, there's no I don't knows, at least out there, that are unaware of people, you're not sure if you're using Salesforce or not. So let's jump right into it. So today we're going to talk about ServiceCloud Voice for the most part, right? We're going to talk a little bit about some other automation stuff we have, but really this is all about ServiceCloud Voice. But we're very excited at Salesforce about ServiceCloud Voice. I remember years ago we were excited about doing screen pops in ServiceCloud. Very exciting time for all of us. And now to be able to introduce and bring out ServiceCloud Voice, that single integrated omni-channel, is just mind-blowing to me. It's a great technology. I think everybody across the board gets something out of this technology, which is why I love it. One of the first people that get a benefit of this is obviously the agents, right? Boost productivity. That's all about, case resolution, getting calls coming in, resolving those calls, using this technology with our AI to really speed up their productivity. The agents love it. No more virtual swivel chairing. Very intelligent routing. It's just a great tool for them, right? So it speeds up that call resolution, and this way you can, keep your customers happy, keep that customer sat score up, and your agent productivity goes through the roof. There's also something in it for IT. So for you, if anybody on the phone is in the IT department, there's something here for you too. Ease of deployment, right? You always want to be able to put great technology in people's hands, make it easy to deploy, really being able to unify that voice and digital channels for true 360-degree data. We could do it on AWS, so it deploys quickly, scales rapidly. So it's great from an IT perspective. To me, this is a dream come true, right? So it's not a lot of coding, not a lot of work to get this up and running. You're going to hear from Neuroflash, our partner, like how fast they can implement some of this technology. It's really great for everybody. All right. And finally, the supervisors, right? The all-important supervisors, making sure that the call center runs smoothly, right? There's something in this for them too, right? They have this whole Omnichannel Supervisor Console, which is brand new. Just a great tool for the supervisor to keep an eye on what's going on with the agents, making sure that their productivity stays up. If there's any challenging phone calls that are coming in or anything that's challenging, happening within the agents or they need to do some real-time coaching, now they have this great console to be able to monitor all that real-time data as it's coming in. Again, some really great contact center insights they're going to get in real time. So like I said in the beginning, ServiceCloud Voice really brings a lot to the table. Across the board, everybody has something that they can get out of this, which is why I love it. On top of that, we're also going to dive into a little bit more automation around the digital engagement experience. We're going to show some bots in the demo, really different ways to add to that digital touch point for your customers, add some automation for them, for you, right, to really make their experience great. So let's do another poll real quick. Top of mind, very topical, right? What are you most involved in? We'd love to know, are you doing some vaccine distribution with providers, with patients, both, neither, something else? That seems to be the hot topic these days, right? Everybody's looking, how are the vaccinations going to be rolled out? So if you wouldn't mind telling us kind of what you're involved in, it would be great, because again, we'd like to even talk a little bit about that during our conversation today if it pertains to you. So we're getting some great results in. Everyone's firing that data in. All right, we'll give it another 2 seconds. And let's check out the results. Wow, okay, so we have, some people are in both, some people are distributing to providers, some are neither, something else. No, this is great insight. And the reason why is we've been doing a lot of research at Salesforce and trying to understand what does vax management mean and how is that putting a strain on the voice channel. So what we've seen over the last several months with everyone working from home, everybody's calling in to different call centers, having different challenges, whether it be looking for the vaccine, doing my Amazon orders or whatever it might be, right? The phone calls are obviously going up through the roof. And what we're seeing is the volumes are up, response times are down, customer sat is suffering. So these are all the things that are leading towards kind of a strained relationship in the contact center, right? So that's why we think that ServiceCloud Voice can truly help some of these numbers and not only help them, but help them quickly. Like I said, ease of use, get it up and running quickly, something unique for everybody. And these are numbers that we're watching here at Salesforce and trying to understand how can we use our technology to make your lives better. So what we want to do is partner with Neuroflash and hopefully you and take some of these numbers and put them in the right direction. So with that, I would love to introduce my great friend, Steve Krumenacher. Steve, take it away.
Scott, thanks very much. Hey, Scott, thanks very much. For those of you who don't know, Scott and I worked together for quite a while while I was at Salesforce. I recently joined Neuroflash, and I'm happy to be here. Neuroflash is a particularly interesting partner for Salesforce in that we specialize in intelligent contact centers. And that goes across not only from Service Cloud itself, but it goes to the digital channels, bringing an omnichannel or a blended experience. And our focus area is really voice bots, which used to be called natural language, as well as chatbots. And we're really good at that. And back when I was at Salesforce, I used to bring in Neuroflash all the time when I had a complex project. Recently, we started to focus on ServiceCloud Voice, and I'll talk about that in just a minute. But as far as background from Neuroflash, the founders of Neuroflash came from Nuance, where they personally were involved with developing some of the most complex natural language voice bots for large medical insurance carriers. And if you listen to some of those, if we shared some of those names with you, you'd recognize them as particularly good natural language voice bots. And Haywire is a company that they founded after they left Nuance. Haywire specialized in two-way SMS to provide customer service via SMS. That company later got purchased by Salesforce and became the SMS channel at Salesforce. We also develop products for Salesforce and products on the App Exchange. If you check out our ratings, you'll find that they're excellent. We're a relatively small SI, but we're focused in on that intelligent contact center. As I said, we're experiencing rapid growth. And in fact, we've deployed more than 25 ServiceCloud Voice projects, which is more projects and customers than all other Salesforce SIs combined. It's really based on our expertise in the contact center, as I was mentioning before, and we're one of the few partners that actually have certification level in Amazon Connect, which is the power behind ServiceCloud Voice, as well as Salesforce and Service Cloud. So we really are able to provide a full multi-channel turnkey solution. So with that, and I don't want to take any more time up, I want to move right over to the demo and and introduce you to Eric Tseng, the Director of Solution Engineering at Neuroflash.
Excellent. Thank you, Steve, and thank you everyone for joining today's webinar. We're really excited to show you some of this powerful technology, and we thought the best way was to show you perhaps a few examples of how customers interact with ServiceCloud Voice and digital channels, how we really build an empowering and efficient experience for your agents and your support team. And we'll also show what it means for your supervisors as they look at analytics to be able to optimize and improve support operations there. So we'll start off here, as I mentioned, on the customer side. We're going to demonstrate ServiceCloud Voice. So I'm actually going to go ahead and call in on behalf of a patient for an organization called Ohana Health. This will be kind of a primary care organization for this patient. And I'm going to ask a few questions around COVID. So I'll ask about the vaccine eligibility, the cost of the vaccine there. You're going to notice how we're able to personalize and provide some automated responses for some of those simple FAQ type scenarios. And then once the issue or the question becomes more complex, you're going to see how we then seamlessly and intelligently route or escalate that call over to an agent in the ServiceCloud Console. So I'm going to go ahead and give it a call here.
Hi, thanks for contacting Ohana Health. What can I help you with today? You can say things like COVID vaccine eligibility, schedule a COVID vaccine appointment, or change my appointment. Now, please tell me how I can help you.
COVID vaccine eligibility.
When available, vaccine scheduling is open to those who are healthcare workers, long-term care residents and staff, first responders, age 65 or older, age 16 to 64 with a medical condition that increases the risk of severe illness from COVID-19. What other questions regarding the vaccine do you have?
Is there a cost for the vaccine?
We are distributing COVID-19 vaccines in a phased approach to all adults who live, work, or are being educated in the state. Vaccines will be distributed without regard to insurance or immigration status. Can I help you with anything else today?
I'm having trouble scheduling my vaccine appointment on your website.
Let me get you in touch with an agent who can help schedule your appointment. Thank you for calling. Your call is very important to us and will be answered in the order it was received.
So as I mentioned, you heard some of the personalization, the self-service capabilities we have. The advantage we have is that the telephony platform is running on Amazon Connect. So that voice bot or that IVR interaction that you heard there was actually powered with Amazon Lex. And with that, we're able to drive some of the personalization, as I mentioned, and really natively actually access data within Salesforce to be able to provide that information back to the patient. We're going to switch screens here to the ServiceCloud Console. And you'll see here, I'm going to now act on behalf of perhaps a call center agent. The first thing you'll notice is that we've actually routed the interaction through Salesforce Omnichannel. So this is going to be now the single source of truth for all routing of interactions. And now with the introduction of ServiceCloud Voice, we can also natively route any kind of voice or phone interaction to the right agent with the skills and availability to handle this conversation. Omnichannel can be used in a number of different ways, and the versatility we'll demonstrate later on with some digital channels and bots. As you see here, we're now fully engaged with the customer. From the call controls perspective, we have some basic call controls within Omnichannel. We can go on hold, end calls, mute ourselves, add callers or conference in another caller if needed. But you'll see here the powerful part with ServiceCloud Voice is that we extend the workflow beyond just the Omnichannel widget. So you'll see here we can actually pop what's called the voice call record. So this is an object in Salesforce that is really providing enough of the fields and metadata required to provide a more efficient agent experience. So you'll see first and foremost, we can start to identify caller number and also some metrics such as the call accept and end times. We use a lot of the fields and metadata here to drive some of the reporting and analytics, which we'll show. But in real time, as I mentioned, we provide a more enhanced or an expedited workflow back to the agent. So using the caller number, we can automate a lookup on the contact information. And you'll see here we have a full view perhaps of exactly who this patient is. Any additional information in Salesforce that's related to the patient can also automatically be surfaced and relevant to the agent. You'll see here on the right side, we have call controls also within the actual page layout to further extend their workflow to the actual voice call record. And we also start to think about how we provide the agent more context or even a head start as they start working off a case potentially. So you'll see here, based on that interaction that the patient had with the IVR, we've actually gone ahead and automatically created a case and pre-filled it with some of the information we've collected. So we know this customer is inquiring about a appointment scheduling for their COVID vaccine. So this case is giving them a head start. They can go ahead and start to disposition the case and start to expedite the process from there. You'll notice as I'm speaking in real time from the agent side, we have a conversation widget that's working to provide a real-time voice-to-text transcription. So this is showing not only what the agent is currently saying when on my side, but can also display exactly what the customer is saying in response. This provides us a lot of unique capabilities from a reporting perspective, but in real time, we can also provide further guidance or assistance to this agent. Because we know COVID vaccine policies and procedures may change constantly, we need a better way to perhaps train our agents or give them guidance for certain workflows. And using the ServiceCloud Einstein portfolio, we can actually leverage features like Next Best Action to provide the agent some guidance here. Next Best Action is actually looking closely and monitoring that conversation widget and understands that this patient is looking to reschedule a vaccination. Once we accept this Next Best Action flow, you'll see here, it's going to provide a few layers of functionality. So first and foremost, we know we're live on a call with the customer, and we want to make sure we provide not only a great experience for them, but also provide the right workflow to expedite the process needed to be able to fulfill the case here. So we can provide a level of call scripting that's personalized back to the patient. In this case, we know since they need to schedule a COVID vaccination, we might need to collect additional information here. So we can ask them questions using the scripts, collect any information we need to trigger any process automation. So we know perhaps we need to categorize the current situation they have. And because we know they need to visit one of the locations for Ohana Health, we can then collect perhaps location information to see which branch they need to visit. This is actually all being powered by Salesforce's Lightning Scheduler to identify the location and perhaps the time and availability for a physician to be able to administer the vaccine here. You'll notice here, based on our inputs, we have some availability. And once we've gone ahead and confirmed with the customer that a specific appointment works for them, again, Next Best Action can trigger off any of the process automation to go ahead and actually schedule the appointment. This could also trigger something like an email confirmation back out to the patient to give them the full details of their appointment. Really, as the agent wraps up their process with the cases, we can also provide real-time visibility back to the supervisors to really understand all these interactions. I'm going to jump over to a supervisor view that's called Omni Supervisor. You'll see here, this is actually going to provide a full agent summary. And this is a list of perhaps all of the agents that are currently available and what their capacity and workload looks like at that moment. You'll notice this is actually an agent that's staffed on multiple channels. So a great benefit of ServiceCloud Voice is now you can have, again, a single routing engine with Omnichannel, routing any interaction, whether it be voice, a chat from the website, an email, a web form, and really leverage Omnichannel to intelligently route it to the agent with the right skills and availability. And with the visibility that we have here from Omni Supervisor, we can actually monitor in real time what that interaction looks like. So we may notice things like a longer average handle time that's exceeding a specific service level agreement. And as we monitor the conversation, there may be an opportunity to provide some coaching or assistance back to this agent so they can go ahead and expedite the conversation. I'm going to switch over here, and as Scott mentioned, we wanted to highlight how we extend the customer experience to different channels. So with the ServiceCloud portfolio, we have digital engagement and Einstein bots that can also provide a unique experience on website properties and destinations. Here on my screen, this is actually a Salesforce community, perhaps provided to Ohana Health patients. So think of this as perhaps this is a portal where they can log in, access existing case information or claim information, even access things like a quick knowledge article or an FAQ to answer some basic questions. And where and when they need to, they can also get in touch with a member of the Ohana Health support team. You'll see here on the bottom right, I'm actually going to engage in a chat conversation. And so this is leveraging the Salesforce chat platform. Just as we showed with the ServiceCloud Voice workflow with the automation in the voice bot, we can create a similar automated experience that's not only personalized, but also provides a great experience to be able to expedite any simple service inquiries. So you'll see here, this is an Einstein bot that is able to identify who this patient is. We can then surface up some menu or button options based on some common inquiries. And so you'll see here, perhaps this patient is going to request information for the status of a claim. Notice there's actually some transactional capabilities. So whether it be with ServiceCloud Voice or with Einstein bots here, we actually also have the ability to be able to extract or pull information from within Ohana Health's own Salesforce instance. But we could also leverage things like an API call out to an external system to be able to pull information right into this chat here. Based on my selections, I'm going to select a claim that I'd like to know the status about. You'll see here we can actually surface up different visual components. So this is an example of a carousel card. We could also use things like a video, mini cards, a carousel to really provide a more visual experience. And this is all part of our Neuroflash UI UX enhancer. With that, as I mentioned, we're also able to provide that transactional information. So we provide an update on the status of that claim or that case there. In this case, again, maybe perhaps this patient needs additional assistance. So I'll go ahead and say, I need my claim processed as soon as possible. We can train the bot on specific phrases or certain words using Einstein's natural language. And we know this is a more critical scenario that needs to be brought to Ohana Health support team's attention. Just as you saw with the voice interaction, we're also using Omnichannel to route this chat interaction to the right agent with the skills and availability. So perhaps we have agents that are working on specializing on claims. This chat is now being routed to that agent. And very similarly, as you saw with ServiceCloud Voice, we have a consistent workflow to be able to operate off of digital channels. So in the center of my screen here, this is perhaps that chat interaction between the patient and the bot prior to escalation. So this agent is empowered with full knowledge on exactly what the interaction looked like. And the screen pop is, again, driven off of the information we have based on that patient on that community. So we can screen pop existing patient or contact information to get a full view of them. And also, again, start to automate that case creation and dispositioning process. Lastly, as we think about all of these experiences, measuring outcomes and performance is a huge focus for us at Neuroflash. So here's an example of a dashboard that's part of our Neuroflash Essentials Kit. And this provides more granular analytics for some of the KPIs around the voice channel. We can start to understand things like call volume, which queues are receiving the most traffic. We also can start breaking down KPIs by agent performance, so start to understand things like average handle time, number of calls per hour. And as we showed early in the demo, start to understand any of the performance of the automation, things like a voice bot, so how many calls were you able to deflect from our contact center, and when we do escalate to the agent again, how does that impact things like average handle time? The great thing with these tools that we have is we have different, the capability to kind of create different views by exactly the ownership of the actual analytics. So we have, these are more call center analytics broken down by perhaps, again, chat queues. We can even start to look at things like sentiment and also call volume by specific numbers. On the Einstein bot side, we try to create similar views here as well. So with chatbots, we're always looking at things like the number of bot interactions or engagement, understanding how many of those patients are clicking on chat and interacting there. And once they start engaging in chat, are we doing an effective job driving case deflection with some knowledge articles or transactional abilities, as you saw with a claims check, reducing handle time when we do pass that chat to the agent, and then also start to present some trend lines back to the team to be able to analyze and understand if there's areas of opportunity to continue to improve it. The great thing on the platform here with Tableau CRM is that we also have the ability to really drill down into specific areas. So if we see there's perhaps a peak in chat volume, we can actually click on a specific area of the chart, have our reports dynamically shift, and those can also present additional insight to the performance of the bot and how that might be impacting contact center operations overall. With that, I'm going to pass it back over to Steve.
Hey, thanks, Eric. Great demo, by the way. I'm impressed with how much you've built that out, and I think it's a very focused and targeted opportunity here to really see what this thing can do. So I want to review a little bit about what you've seen, what Eric showed you, because he did show you a lot. The first thing and most important thing, perhaps, is the fact that native telephony within the ServiceCloud console. It sounds trivial, but that is a highly significant impact. Telephony traditionally has been in a separate channel, and with a CTI connection, you can kind of get a little bit of information back and forth, but you really can't take advantage of any of the intelligence that's built into the console, things like next best action. And with the ability to bring the telephony inside the console, the voice transcription actually allows you to act upon that voice to provide real-time guidance. It's really quite a significant impact and quite a change in the contact center world. We also showed you voice bots, natural language, on the beginning of the call through an IVR. We showed you that intelligent agent workspace, which brought in the capability of things like next best action, and the agent has access to knowledge articles and all the different transactional types of activity they might need to do. And because it is a fully blended workspace, that capability is available regardless of whether this is a chat or a voice call. We showed you real-time voice-triggered guidance. This is particularly interesting because now, based on the voice itself and the understanding of that voice, just like with natural language, you can now provide the next best action without having to wait for the agent to understand what the customer said, type in something into the console, and have the AI react to what they typed. Now the AI system can actually react, the artificial intelligence system can react to the voice itself. We then moved over to the Omnichannel Supervisor view, where you saw the agents that are logged in and what they're working on, current activity, and voice is now part of that. Voice before, when it's not part of ServiceCloud Voice or not part of that console, is not actually shown in the Omnichannel view, other than the fact that you simply know they're on a voice call. Now you can actually look at what's going on in that call, and you can monitor without the need to actually turn on, without the need to listen to it, because you can see the transcription coming back and forth to you. We showed you how you do some cross-channel management, and then we moved over to a community. And again, that same basic capability of those automated bots, in this case we did it with chatbots, is interacting with the customer. And finally, we showed you some analytics where we were able to bring in not only the voice analytics and the chat analytics, but we brought it all together. And that enables us to provide some real KPI improvements. So on the right side, you see some of those KPIs, which we see our customers reporting to us that are improved. But what we like to focus in on as an outcomes-based company is how these things really impact the business side of things, not so much just the activity changes that a capability exists. I want to tell you a little bit about a customer that we recently implemented. This was the first large customer, ServiceCloud Voice, over 1,000 agents. I think it was about 1,250 in a highly regulated industry. Remitly provides international payments, and this is regulated in many, many countries across the world. And we were able to deploy there literally within 4 weeks. And their issue at that point was they wanted to change telephony platforms, and they were able to and they've reported this in a webinar seminar, that they were able to see an immediate 20% improvement in cost just on the operational basis alone for the software and hardware that they needed in place. The next phases of their development are going to be to make that ServiceCloud console and their agent interface more intelligent, and they expect to see, and they've already begun to see parts of this, increased agent efficiency as well as increased agent efficiency. So you're ending up getting both not only the efficiency, but you're also getting a more effective agent interface, an effective customer interface, and that's important. In terms of how you deploy this, we recommend a 3-phase approach. The 30 days, of course, is the phase 1 only, where you're really only replacing the telephony and providing a simple ServiceCloud interface. Phase 2 is where you start to bring in those other digital channels and get the voice bots in there, or the chat bots and so on, and you're starting to bring those things together and starting to automate some of the functions on the desktop. And in phase 3, you're starting to take advantage of where ServiceCloud Voice really shines, which is the ability to start to take those transcriptions themselves and generate next best actions. Now, some of these can be rearranged and combined and so on, but this is the basic approach that we see, and we're able to get our customers up and running within a very, very short time frame. And as I said before, we've been involved with over 25 projects, and many of them have needed to get up and running quickly. And this is a statement of the times, I think. So I know some of you out there in the healthcare industry are saying, yeah, but what about HIPAA? Because we have patient information that goes on in our call center, and maybe we can't take advantage of some of these great capabilities. Well, I do want to let you know that we have come up with an approach that if you have HIPAA concerns, we can delay the deployment of some of the specific issues, and we have a list of them that we believe our customers are concerned about. In fact, this is what they've told us. And we basically put that stuff in a sandbox in phase 2 of that chart I showed you a minute ago. And we're ready to deploy as soon as your legal team feels that the product itself, either from Salesforce or Service or Amazon, meets the HIPAA requirements, and then we can immediately put that into production. So we're seeing this across the industries, and whether or not HIPAA is a concern for your particular area, we know how to deal with that. So what I'm going to do now is I'm going to say, I wanted to show you, I forgot this slide. I wanted to show you what that journey looks like. Once you engage us, we'll immediately start on the requirements review. And then we can pretty much start to build and implement. We need to understand the call flows that you have. We'll get that built for you. You need to test each component of it, and then we can go live. The slowest part of this whole process is usually porting over the phone numbers, which obviously have to do with the carriers and not us. And our success rate, again, has been very, very high with trying to get customers up and running quickly. So let me tell you how that engagement would get started. Jenna Sirkowski, who's our healthcare representative at Neuroflash, is available. She's on the phone, and here's her contact information. We'll leave this up and the slide up, and we'll provide that information for you. And let's thank you very much for the time you've taken today, and let's move into the Q&A phase.
Thank you. Yes, we are going to move on to the Q&A. There is still time to submit your questions using the Q&A tab to the left of your screen. We have a lot of great questions already, and we will try to get to as many as possible. This first question is for Scott. How is SCV different from existing systems?
Sure. I'd love to answer that. So the thing I love about ServiceCloud Voice is that it's really that end-to-end phone support, right? It's the idea is it's a one-stop shop for all your phone support across the entire ServiceCloud suite, whether it be the telephony system, the screen pop, the call transcription, agent automation, Omnichannel Supervisor support, call analytics. Like, it has everything tied together. The difference is between maybe previous products that we've put out or competitor products is that it is truly a one-stop shop, right? For all the things that you're going to want to do, wrapped up really nice in that ServiceCloud Voice package. So that's the key difference.
Thank you. Our next question is from an audience member who wants to know how you authenticate the patient on the chatbot.
I think Eric should take that one.
Yep, I can take that one. So with the chatbot that you saw in the second part of the demo that's sitting on that portal, that community, a lot of different ways we can authenticate and understand who that patient is. So one way you could do it is if you're leveraging Salesforce communities, Salesforce Chat natively will be able to identify who that patient is as they initiate chats. That's more kind of a native solution. We've done other things such as having the patient provide a unique identifier within the chat conversation. So it could be a patient ID or number, and that could be used to identify them. Other more technical scenarios could be passing credentials back into the chat session. So there's a lot of variety of ways where we can make that possible.
Thank you. The next question, there's a comment from a member. Right now, Salesforce's chatbot is not HIPAA compliant due to some of the architecture running on AWS. Steve, would you be able to address that for us?
Sure. Yeah, this is an interesting question, and HIPAA obviously is a concern for some folks, especially if PHI or PII is there, and there are some components, as you well pointed out, of the Salesforce solution that are not yet considered HIPAA compliant. I can tell you that with a couple of minor exceptions, Salesforce is willing to sign, or in many cases will sign a BAA to provide the HIPAA compliance relevance for those, for all of Service Cloud and for other components, and they're bringing more and more things in every day. And Amazon Connect is also willing to sign as a BAA for the capabilities of Amazon Connect. The way we approach this for folks that is not sufficient for is to take those components of the solution which and again, this is something that every individual customer has a different view on, but what your legal team feels are issues, we will not deploy that in phase one. We will put that in phase two or beyond, and we deploy it in the sandbox to get ready. We would highly recommend you start the process before you actually deploy rather than to have to wait. But as you well know, Salesforce is on a continual path to get more and more of the components inside the HIPAA or the BAA framework.
Yeah, correct. And I just want to elaborate a little more on that, Steve. This is Scott Jaworski. I'll say, if you're a Salesforce customer, you know and love the Safe Harbor slide. We didn't put it up there, but I will say Safe Harbor applies to some commentary here, is that we do take HIPAA compliance very seriously at Salesforce, especially in the healthcare life sciences vertical, which I operate out of. And we are striving to make all of this HIPAA compliant. We're hoping that in the coming several months that you'll see more of these components HIPAA compliant. It is high on our radar screen. But what we're trying to do in partnering with Neuroflash is we don't want to stop you guys from having some of these benefits, whether it be chatbots or ServiceCloud Voice, whatever it might be. We want to work with you and Neuroflash to figure out what can we implement now and get queued up, be ready for that when those other components are HIPAA compliant, you're ready to go, right? And you basically, it's turnkey for you guys. We don't want you to not have the benefit of some of these technologies and be able to use some of these pieces of these technologies and having to wait maybe several months for all of it to be HIPAA compliant. We do have customers that are engaged in those conversations with us now around, hey, how can we do this and move forward? We want to get up and running. So I definitely encourage you that it's worth a conversation with your Salesforce account executive and Neuroflash. Have the conversation. Let's dialogue about it. Everyone's a little bit different and unique. We understand that. But let's have the dialogue, and then we can come to a solution for everybody.
Thank you, Scott. Our next question is, what licenses are needed to implement SCV? Scott, could you answer that for us?
Sure. Basically, Service Cloud. Core Service Cloud licenses. Service Cloud Voice lays on top of that. Service Cloud Voice is a license for all of your agents, so it's a license per agent, but it's a pretty seamless license to add on to your current package. And that's it.
Thank you, Scott. And the next question, what resources would we need to get this up and running? Eric, could you answer that?
Absolutely. So as we were showing the solution today, half of it really sits on the Amazon Connect platform, and the other half is configured within your Service Cloud environment. So when we think about the roles and responsibilities, you definitely need assistance and knowledge from the Amazon side, developers that can really build out the Connect platform, start to integrate into other systems. At the same time, there's a design aspect to it. So certainly having a voice user interface designer, thinking about what that voice spot or that IVR experience looks like. And certainly, as you saw in the demonstration, when we do pass that voice call to the team in Salesforce, certainly having the right designer to build up that console view, but Salesforce admins and developers working through the actual configuration of the routing, the screen pop, any integrations we might need to power that interface there. I will add, as Steve had mentioned, here at Neuroflash, we are a Platinum Salesforce consulting partner, and we're also SDP certified on Amazon. So we have the skills in-house really to leverage both technologies and really kind of bridge the gap between both solutions there.
Thank you for that. And we have one final question. We had a lot of great questions today, and we couldn't get to them all, but we will try our best to get back to everyone who submitted personally after the webinar. And this final question, if we are interested in now, how quickly can we get started? Steve, could you address that for us?
Sure, we can get started immediately. Up on the screen right now is Jenna's contact information. We're ready and willing to take your call today, in fact. and we'd love to have the conversation. As I said before, we've had several customers get up and running in as soon as 30 days. To get a full deployment, it might take a bit longer if you want that full intelligent contact center that Eric had shown you in there. But from a telephony replacement viewpoint, from the ability to get a contact center up and running quickly to deal with the surge in calls, we can get started immediately and have you up and running in less than a month. Thank you.
Thank you, Steve, and thank you to all of you attending this Fierce Healthcare webinar and for submitting so many great questions. I'd like to thank our speakers for participating and Neuroflash and Salesforce for presenting today's webinar. This webinar has been recorded. You will be able to access the recording within 24 hours using the same audience link that was sent to you earlier. Thank you again for joining, and we look forward to seeing you at future events.